Spring is here, and unfortunately so are spring allergies. Studies already showing pollen is worse than ever. We're joined for this Mindful Monday by Mayo Clinic allergist Dr. John Wheeler. Good morning, Dr. Wheeler.
Good morning.
Thank you for being here.
It's a pleasure.
Although we're talking about a topic that, isn't the most fun topic, but it is necessary, right? So just start by telling us what some of the most common spring allergens are and how people can identify which allergens are maybe triggering their symptoms.
Certainly. It's tree pollens, first and foremost, in this time of year. We saw that the maple sap ran really early, and so the rest of the pollens have actually followed that pretty well. And now, even yesterday, I saw maples blooming. So the tree pollen's been out for several weeks. The bees have been collecting it, and it's been affecting all the humans too. A runner-up at this point is mold spores in the air, and we'll soon be following with some grass pollens very soon. And so we're looking forward to that.
Yes, of course. Okay, and so, kind of touching on what you're just saying, a recent study is showing that over the last 30 years, the pollen season is, starting sooner and ending longer. There's also 20% more pollen. So is this in line with what you're seeing? Anything else that you're seeing in your patients?
No, we're seeing more extreme allergies in general, just as you mentioned. We're thankfully able to treat that more effectively with newer medications, and of course, immunotherapy does play a role.
Okay. And so how can people know, do I have the flu? Do I have COVID? Do I have allergies? What are some kind of markers to tell the difference?
Probably the most important thing to keep in mind, if it doesn't itch, it's probably not allergy.
Okay.
Itchy nose, itchy eyes, it's the itch that brings it out. And so after that, having colds this time of year can also be a problem, but that's more nasal congestion. That's probably more cloudy than clear, and the runny, itchy eyes are probably the foremost, as I mentioned before.
Okay. And are there any tips, to minimize our exposure to these spring allergens?
Yes, yes, indeed. In fact, keeping the windows closed, unfortunately, is probably the most important thing to do. Using a air conditioner with a great filter, using a premium filter on your furnace, should that be needed, using HEPA filters inside, and of course, thinking about the dreaded masking again, but that is effective for reducing pollen exposure. And spending more time outside, even before the sun rises, as we both do, to kind of cut down on the exposure that way too.
Okay, good to know. So a mask, we thought we were done with the mask.
We thought.
Okay, that is a good tip though, if you're really having troubles there.
Absolutely.
And when should people see a doctor?
I think when their allergy medications aren't effective from their perspective, if they want a little more different options, actually, would be a good idea too. And of course, thinking about immunotherapy, that's what we help people to reduce their tendency towards having allergic reactions to these pollens and molds and dust mite as well as pets.
Okay, so what happens during immunotherapy?
Immunotherapy, from our perspective, is they get small doses of the immunogen, build up very slowly over several weeks, and then a monthly shot for 3 to 5 years for an impact to reduce their immune tendency to having runny nose, itchy eyes, scratchy throat towards the allergens that affect them.
Okay. Any other, new or innovative therapies that you're doing, or is it really immunotherapy what you focus on?
Well, we focus on immunotherapy, but there's also medications, and using them in combination, I think, is important. And also keeping in mind there's other options such as saline. Saline's kind of underrated in some people's perspective. I think neti pots, nasal washes, even some of the more new ideas are great too.
Okay, good advice there. All right, Dr. Wheeler. Well, thank you very much for joining us and
Pleasure.
telling us these tips.
Thank you.